this is the time to transform healthcare. We have the tools to make the healthcare system much more humane and that delivers a better experience to patients, that can keep people healthier for longer, increase their health span, and that can, where we can intervene earlier at a much lower societal cost. But it requires bold innovators that are willing to take those calculated risks, and investors who are willing to support this process that can be highly rewarded for doing so.
Welcome back to the DNA of Things. Dr. Jeremy Koenig. Now, over the last 100 episodes or so, we've explored the building blocks of our world, from genomics to infrastructure to the hidden systems that shape behavior. And today, we're talking about something that affects all of us: how healthcare gets innovated, how it actually changes, and why most innovation fails to reach patients even when the science is sound. My guest today is Mariano Bendersky, Head of Innovation, Digital Healthcare at Sanofi. But his real expertise is in something that rarely gets discussed. That is the gap between building brilliant solutions and actually getting them into the hands of doctors and patients. Mariano comes from private equity, from building companies, working across Argentina and the United States. He brings a rare perspective. He understands finance, operations, culture, and medicine. In this conversation, we talk about the evolution from digital health 1.0 to the AI era, about why 70% of physicians are burned out, about the cultural differences between how societies approach unlimited need and limited resources, and about what it actually takes to transform a system as complex and as entrenched as healthcare. This is a conversation about the DNA of healthcare transformation. Let's go.
Mariano Bendersky is an international business leader and entrepreneurial executive with over 20 years of experience driving large-scale digital health transformation. Most recently, at Sanofi, he led digital healthcare and innovation for the U.S. type 1 diabetes franchise, pioneering AI-driven early detection initiatives, telemedicine, enabled screening programs, as well as strategic partnerships to manage chronic diseases. With an MBA from Kellogg, Bendersky has a diverse background as a former CEO who scaled an insurance group X and a private equity professional-focused pharmaceutical vendor and healthcare investments. He is a transformation leader dedicated to removing system friction and using technology to deliver more empathetic, human-centered care. Mariano, welcome to the DNA of Things, my friend.
It's a pleasure to be here, Jeremy. Thank you for the invitation, and I look forward to exchanging some thoughts that hopefully will be valuable to your listeners.
I'm sure of it. You know, I'm always excited when I'm talking to an entrepreneur, and well, yes, an entrepreneur certainly, also an engineer. But then when I also hear the word, empathy mixed in to the bio, right? And the reason why I bring that up, I think I might have shared this with you last time. I've been rediscovering this book, Systems Thinking, Systems Practice, by Peter Checklin, and it's just blowing my mind. You know, I read it like a slow walk, like I really dwell in it. You know, and there's so much intuition in here insofar as, you know, the soft systems movement and, really like what hard systems engineering has taught us, but, how impractical that is for the, more complex human messy problems to be figured out. So I know with your background, you love big challenges, big problems, and, with your experience in digital health, I think this conversation is timely because you've seen how systems has evolved throughout your careers. With that as a starting point, really interested to get to a jumping off point here of, your journey into healthcare transformation generally. So how did you move from, engineer to becoming a CEO and working in private equity to, be leading digital health initiatives?
Yeah, I mean, I think you raise a very good point, which is around system thinking and finding difficult problems to solve for. I was working in private equity a long time ago as a private equity investment director and was able to understand and learn the mindset of an investor building investment theses, helping assets or assess investments and structure and negotiating transactions. But then I realized that most of the value actually comes from the operating performance of the assets of the companies that are in the portfolio, right? I did have a consulting background, but I thought I could do much more to help shape that performance and drive a better outcomes. So that's when I had the opportunity to join this insurance group as a CEO, and I had direct operating exposure, and helped transform this small company into an innovation engine, which grew significantly, and we had a partial exit. Now, this also exposed me to the beauty of innovation-driven growth and transformation of an industry, actually, because the insurance industry went through a significant digital transformation, and it's like healthcare, a regulated industry. And then when I thought healthcare has always been part of my life, I grew up in a family of doctors in Argentina, and although I'm not one, it has always been part of the conversation in my family dinners, and so on. Now, as I was living in the U.S. and saw that healthcare is a truly systemic problem to solve for, and it's I had a rather, I would say, underwhelming experience with the healthcare the healthcare system in the U.S. And as I was looking for my next professional chapter in my life, I realized healthcare was at that point the last heavily regulated industry that hadn't been truly disrupted by digital innovation. And I really wanted to be part and lead that transformation. And that's when I decided to join the digital healthcare team at Sanofi.
You like to take on tough problems. And when you talk about the digital transformation of healthcare, I mean, that's a new frontier. So what was the problem set at the time, and how were different stakeholders responding to the proposed changes, which, admittedly, it couldn't have been seamless to start?
So that's a great question. When I joined this effort, I would say digital healthcare was in the 1.0, let's say, stage, in a sense that typically it was more geared towards chronic disease management, and it was geared more towards merging medtech with digital tools. And so being able to read information or data points from your Internet of Things kind of devices, either glucose monitors or other devices that would measure different biomarkers. I think today we have newer tools, right? And we're at the stage in which AI brings a whole new world of opportunity on digesting all those newer data points that we have now, and those connected devices. And you were talking, we were, before this conversation, we talked a little bit about the multi-omics and so on. I think AI brings about new opportunity and depth into analysis, sifting through those seemingly disconnected data points and find trends and themes that can transform patient outcomes.
Right. So, I mean, it's a big jump. It's a big jump just even in the last 2 years, right? And you've been doing this for the last, 20. One of the things that you have experience with was, coming to, drive very specific and particular outcomes. One thing that I can fall in a trap sometimes, insofar as oh wow, this data is so cool, and I can build my own Jarvis, and softwares that I built 10 years ago that required teams and time and money can now be done in an afternoon. But it's tempting to sometimes just be, because all this is so new, it's I could build this, I could do that, and then you do it and you don't ship it, and so there isn't really any that you've driven, because I'm just speaking myself, because in an afternoon you built something that you haven't shipped and you haven't validated. But when it comes back to your experience, you were really pointing to specific outcomes where you moved the needle, something reducing the wait times to specialists, for example, from 6 to 9 months. I think that was something that we talked about, right? And that's that's a really big deal. Having actually just gone through that myself, like waiting, to get in front of an ENT. And it's like, okay, well, it's going to take 18 months, not 9 months, 18 months. It's like, okay, but how do you, why? And oftentimes that's just an administrative inefficiency. And so what was that like when, you kind of identify the bottleneck and the source, and you and your team could celebrate as here's the outcome that we've actually facilitated? Was it kind of a gradual unfolding, or was it, very, kind of acute and significant, and something that you were able to see pretty quickly?
So I think you bring about, I would say, two very interesting points in that question, right? The first one is this disconnect between building something and actually driving outcomes. And I would say there's a lot of focus today in that sense of building newer models, newer AI models, better AI models, and that's great. However, I think if you don't have a way to operationalize those models into the workflow of healthcare, it doesn't drive actual outcomes, right? So I think that's I would say the biggest insight that I got from driving programs of AI into the healthcare systems to try to early detect disease, for instance, right? So that you need both legs. You need a great model that predicts the outcome, and you need a way to operationalize this into the healthcare system, preferably within workflow, and drive impact and change behavior, let's say. The other piece has to do with a specific problem of thinking through how can we improve access to healthcare or timely access to healthcare? Let's put it that way, right? And I think there's also opportunity, and we've seen that happen through telemedicine, for instance, where you're driving these newer programs that are direct to patient, for instance, that are sprawling, are creating much more access to for patients to see specialists or to get access to screening information. As you know, medical information doubles every, I don't know how many days, but it's a matter of days, not years, right? So it's impossible for all doctors to be educated on every single new piece of information. Now, when you see patients that are not educated on a disease state or are starting to search, and now you see the newer, let's say, LLM versions for healthcare that are being accessed. So I was seeing statistics that OpenAI shared that they had, I don't know how many millions weekly consultations on healthcare issues, right? That is driving and changing the conversation. So how can we provide timely access to information? But again, if you don't have a vehicle to get access to diagnostics or prescriptions and so on, you don't get access to being properly diagnosed or quickly, timely diagnosed, and then have the ability to have a conversation with a specialist. And you're in pain today, right? Not
Right.
in 9 months. So
Right.
I think that's a problem that we need to think how to solve for. The patient experience today, in the majority, is not great. And we have the tools to improve it.
Right. Well, and you and I were connected through Poirier, he's founder, CEO of IX Layer. And he's actually had another guest on recently. His name is Chris Spears, founder of Orderly Meds. And it is this problem of direct to patient access to facilitate, the fact that exists now, and how is that going to affect, pharma's go to market model. And then there's that, kind of that emergent property now because of things like, telehealth and, all these, different, kind of out of pocket services like, Function Health and Orderly Meds is another one. And I think that's what Poirier's system solves for, right? Is connecting patients to prescriptions in collaboration and partnership with those who develop the therapeutics. But there's more innovation emerging in this space. I think Orderly Meds is not quite the same, but I think it's complementary to what Poirier is doing. I mentioned to you that I had Mike Polcari on a couple episodes ago from 23andMe, where he's really more about how do I democratize the models so that whether it be a direct patient platform, consumer platform, or a clinician platform or a D2C provider-like function, like how is he empowering those organizations to pull in the models in real time? Because like you said, is like the scientific innovation is like, it's not like, months and years now, it's days, days and weeks. And so, you have the practitioner who, they have their evidence-based expertise, say it's on, type 1 early diagnostics, type 1 diabetes, or type 2 prevention, whatever. They're going to have their this of for implementation, for hopefully avoidance. Obviously, like they developed that practice after going into the profession. Like, you had parents as medical doctors. It's okay, you learn what you learned in medical school, and you go out into practice, and they call it practice because you have to keep practicing, because it's not exactly the same as what was in the textbook or what you experience in med school. And actually seeing each person with what ails them is what becomes a true challenge in the journey. And now you have this all swirling with innovation that, ultimately the caregivers need access to that, but there's often, kind of friction between them getting this new insight and deploying it quickly. And so you're somebody who has the experience of, working with larger institutions and bringing innovation, which can often be really challenging, but you're now like also branching out and working in advisory roles and, working in health tech and, assessing that landscape to, as you say, like solve the next big problems. And so I'm interested to get your sense of what you think those problems are, and maybe we could just start with, connecting the person with the condition to the right drug, let's say, because I know that's, we have a, shared point of origin there. Yeah.
Yeah, I mean, this is a question that I get a lot from the startups or scale-ups that I advise that are looking to, let's say, sell into large corporations, either in healthcare or in pharma, right? And most importantly, selling into these corporations requires not only to have a very crisp and clear value proposition, right? That needs to solve a real problem and be able to tie it up to some of the needs that these corporations have, right? But also it requires some, I would say, intelligent strategic patience, right? Because these corporations don't move at the speed of smaller companies. But when they move, they can really scale innovation. So I think their role in the ecosystem is more to scale innovation, and smaller companies are the ones that bring the innovation through life, the first stages of that innovation. And what do I mean by this? I mean, in order to be able to let's say get something innovative through the process, and be able to actually have an impact on the market, you need to understand the budgeting cycles, the buying cycles of these corporations. What are the stakeholders that need to be involved in that decision making? You need to develop and foster multiple champions within the company and onboard many stakeholders strategically, right? So when you might think, okay, I have a great solution, right? But first of all, is this a solution? What is the relevant problem that I'm solving for, and connect who is the right buyer for that problem. Sometimes there are solutions that their natural buyer should be a healthcare system, but then they are targeting pharma because pharma has larger budgets to spend rather than a healthcare provider. But then this is when the product struggles to connect the dots between a real pain point that pharma has and what is the actual solution that you're developing. So these are the things that need a little bit of guidance and navigation, that not always entrepreneurs understand the nuances of the different roles within, let's say, a pharma company, from the medical organization or the commercial organization, who is the right buyer for different products and so on. Does that help?
Yeah. What it makes me think of is I think round one of the direct-to-consumer DNA industry, for example, round one of the direct-to-consumer DNA industry is really just kind of selling DNA is really cool. Right? And I think the idea that yes, everybody should have their own copy of their genome, absolutely. But what problem was it really solving? Now, ancestry is something different, right? I'm not suggesting that that's not a use of DNA, like it is, but it's not health outcome that you're trying to drive. It's more kind of entertainment. Now, I understand that there's an ancestral component of genetic markers that need to be taken into consideration. But on the whole, it was access to your DNA, and like DNA was being sold, right? Like that, and I think early adopters and hobbyists were the original buyers. But now what we're seeing is in moving into the multi-omics frame, it's like, okay, well, you can get your bloods and you can get your, microbiome and your DNA. And it's like, okay, all those things are really cool. But the outcome I think that we're really driving toward now is what so pick an outcome that you might want to improve upon, and then how would those tools help you with that? So I think about like age-related macular degeneration. It's like, oh, okay, well, I know I have a genetic predisposition for that. I'm noticing that my sight is failing at reading, and is there a way for me to prolong that? Am I genetically predisposed? And if the answer is yes, then okay, now I know. And then there's an avoidance strategy or a reduction in the progression rate. But the supplements that you use would vary based on your nutrigenomic profile. But the point is that you can get a precision blend of nutrients that helps you see longer. Like that's a really cool outcome. It's like, hey, my vision is declining. I solve that problem for me. And another one might be fertility, in vitro fertilization. How do you use like a multi-omics approach to, if it's an IVF process, facilitate full-term babies? It's like, oh, well, actually, like knowing the vaginal microbiome would be a good indicator, right? So like you're starting to see the application now of these tools, and that's like really, really exciting. Whereas before, I mean, when I started thinking about this like 20 years ago, it's like, oh, wow, this is cool. You can clone stuff and you can do stuff. But like now you're really starting to see, like, I wouldn't say mainstream, but it's definitely becoming adopted by, like, in terms of preventative care, like, functional med docs, naturopathic doctors are looking for root causes. And then now that the technology can basically harmonize that data into a signal, interestingly, it becomes less about what omic data you use. It's really about how does that translate into an activity set that's going to improve the outcome. So that to me has been really exciting, and insofar as being very real in the last 5 years, like starting to see companies coming out and solve for, really serious issue. And rare disease is another great example. It's just, the economies of scale were never going to work in the old way in terms of conducting research, and that's changing. So anyway, coming back to, the challenge here is, as you say, one of the things is, how do you communicate this effectively to all the different stakeholders in such a way that this, important solution set comes in by its own merit and with a good economic argument for it? So there's that, right? But then you have another layer above that, which is the private equity firms. So, so what does that look like? Because I kind of look at the companies as, operationalizing the innovation, and then the private equity is a layer up, and that's like, well, how do we guarantee an ROI for our sovereign wealth funds or whatever? So
I
how
mean,
does that work?
I think no, I think you touch a good point, and I do collaborate with. I'm collaborating with some private equity firms in thinking through how to build those investment theses in the vendor ecosystem to sell into large enterprise, and I think this is where it gets interesting, because not only, well, I think we are in a very unique time in history, or where we have the tools are there to transform healthcare. And that requires everyone to chip in, right? So the tools are there. We need the investors to align. We need the regulatory frameworks to evolve. We need the payers to restructure the way they think. And we need to transition our system, as you mentioned, from a more of a reactive care that we intervene once the disease is already here or the symptoms are very evident, to a healthcare that goes earlier, detects disease earlier, intervenes earlier, transform the trajectory. And that will reward, that will create a healthcare system that is more humane, delivers a better experience to patients, and that has a lower societal cost and financial burden, and also rewards investors who are savvy in picking the right companies and the right solutions to fund. And this is where I think there's a win-win for everyone in this engagement. I think this is a topic that is very systemic, as you mentioned earlier, and requires everyone to sort of shift the lens through which we're seeing things and trying to think through how can we do things differently in a way that truly transform the way the system works.
We talked about Right.ai before, RY.
Yeah.
I spoke to their CEO and their chief medical officer, so Simon and Chatty, and I thought we came to this interesting, idea around innovation, like what their approach, what their solution set actually achieves, and it was kind of neat because Simon is an Olympic athlete, and so we landed on this term of like readiness. So that is like institutional readiness to participate in a trial. So like oftentimes like you might sign up a hospital or a university, and from an institutional standpoint, like their integrity, their track record of performance, their notoriety is great. But in terms of their readiness for the particular solution set, the specific subjects under question is, we know that's where research falls down a lot of time, where a lot of these clinical trials fall down is like recruitment. Number one is not recruiting enough. And then, the efficacy and the follow through. And so they've developed a way to, actually assess those things from, I think, public data sources, public domain, and actually like priority rank organizations, for the CRO who's been doing, conducting the, that kind of consultative services on behalf of the pharmaceutical companies. And so like that to me is like, oh, wow. Like that's like, years of, and, probably, decades of mistakes being avoided. And so what are your thoughts on the future of the development of therapeutics for taking into consideration the B2B? So there's the D2C, direct to patient insights from organizations like ChatGPT. And then you've got B2B solutions that can kind of, mine these data sets, to really get to a more fine level, research and study design as a result. So and to me, like that's really emergent really in the last couple of years. And I'm interested to know what you think about that. Are you seeing it from a slightly different vantage point? What got you excited about therapeutics in general?
I think in general, the AI enables a transformation of the whole pharmaceutical life cycle or environment. On the R&D side, it enables faster, better targeting of molecules and creating better discovery. In the development side, it creates the opportunity, as you mentioned, like the one that you mentioned, into faster, let's say, faster and more targeted and better studies, medical studies. And then on the commercial and go-to-market model is also being transformed by AI through better physician targeting, improving the type of content that is delivered, engagement. It is transforming the omni-channel engagement on the medical community as well, on finding the right key opinion leaders and ways of delivering content to those key opinion leaders. So I think it's a really wide and opportunity, and there's a lot of companies out there building great solutions for pharma, and it's an opportunity to reduce timelines, improve the throughput of new medications, and better therapeutics that help a lot of people and improve outcomes of a lot of patients out there. So I think it's about finding the right therapy for the right patient at the right time. And this is something that through data and news data sets, as you mentioned, DNA, that enables precision medicine and others, I think we're going to make a huge difference. We are at the verge of a significant transformation here.
Last fall, you had mentioned your experience as a patient, right? Your background coming from Argentina. How has that influenced your worldview on healthcare access in the U.S. today? Because you have a country to compare it to. So what is the contrast that you see, and what's the opportunity here in the U.S.?
Well, I think the healthcare systems are completely different in both countries, but also healthcare presents a very unique complexity, which is that you have unlimited need and limited resources, right? So every society has to make a choice in terms of what is acceptable and what is not acceptable, and what types of who gets what, and different societies make different choices, right? Different cultures, different history, and I mean, I don't think what is right and what is not right depends on the values of each society, and there are a lot of discussions that could go more on a philosophical level on, let's say, things of who should get therapy, the one that can pay it, or everyone, or everyone else. But the resources are constrained, so you need to choose. Do you prioritize someone who is elderly versus someone who is young? Do you prioritize urgency versus a chronic disease? So at this point, I think obviously my coming from a family of doctors and growing up in Argentina, it's, I would say, more of the general process of that healthcare should be accessed by most or everyone. But I understand now that I'm older, I understand that there are constraints in terms of budget, that you need to make choices. Sometimes there are hard choices. But I think the US has a system that is not great at chronic disease management, and it needs to improve. The time that you spend with the doctor in healthcare delivery is very short, and doctors want to spend more time with patients. They want to deliver more empathetic care, but today they are burdened with a lot of admin costs or admin time and burdens. There's a lot of burnout that needs to change. Technology can help, make practices and healthcare more efficient, reduce that admin, that we can bridge that gap a little bit. Some things could be solved by AI on the front end to deliver some of the aspects of healthcare that you don't need, that are more are simpler, and you don't need to have a doctor there, and focus the doctors where are needed the most in delivering that healthcare experience. But there's a lot of opportunity for improvement.
That hits home right now because here in Halifax, Nova Scotia, they've launched a program. It's called like One Patient, One Record. And basically it's, a good initiative is that let's get all of our data in one place. Remember those medical alert bracelets? I don't see so many of those anymore. Like if you're allergic to penicillin, I remember kids would wear those.
Yeah.
And then that's an example. Is like you carry that with you everywhere. Like that's your, not just in the province, but, globally. But I know some practitioners, some docs in the area who they're really struggling with the implementation. So they were already, as you mentioned, there's like, clinician, physician burnout. I don't know what the stats are in the US, but I think I read something in Canada, it's like 70% of clinicians wouldn't recommend their careers to the next generation because there's just so much overload, so much burnout. And then, you bring in this new system that's in the long run supposed to have, this positive outcome because, you're able to see your patient fully because you have this AI co-pilot, so to speak. But the setting it up of, doctors who, frankly, if you're like a Gen Xer, I guess is the ones that I'm talking to right now, you're kind of in that like in between phase of, you're good enough at technology, but, you've really honed your craft insofar as if it's emerge, GP, specialty, whatever. But like that kind of technical component is something that is like, now it's like a new skill that you're asking the clinician to, to implement while they already have this kind of, really overloaded patient base. So I wonder if there's like a solution there, like in the implementation. It's like, you don't need to be a doctor to do the implementation, do you? Like, and I think there's there's a human element of that, right? So, are there specialists who are like, you can think about informatics in general, like medical informatics or epidemiology, people studying in epidemiology as like, hey, like maybe you folks are the boots on the ground to help, usher in this new wave of technology. Cause there needs to be like it's like a human to human training, right? Rather than having just like a human, technical interface. I mean, like I know I love spending time and, figuring out how to use all these different models and setting up local environments on my machines, but I don't have, patients whose lives are hanging in the balance, kind of waiting to get in. And I guess what I'm saying is it's a very different mindset, right? To learn a new skill and to be in that point of like creativity and growth versus scarcity and urgency for the people whose lives you're trying to save. So I guess that's a very like human problem that I'm seeing now. Have you come across anything like that in healthcare, through the years or, most notably now?
I mean, I think first you raised the issue of, let's say, healthcare data fragmentation, right? And I think it's a true problem in the healthcare system in terms of it's not only, but it raises also other issues or in terms of data governance and how do you implement things that are appropriate and are secure, and introduces having all the data in one place also introduces some cyber risk and so on, which are not negligible in today's world and needs to be thought through as well. But I mean, now in terms of implementing change or implementing software or I think the beauty of AI, and I'm optimistic about this. I don't think we are there yet, but I'm optimistic about this, is that it has enabled a lot of non-technical folks to do things that were used to be done only by technical people. You see the trends in vibe coding or being able today you can code an app, build an app without being a developer, or you have never put in one line of code and now you explain what you want the thing to do to Claude or to Cursor or all these Lovable and so on, and then they deliver code, they deliver the tools, and they explain you how to deploy it, how to like a step-by-step guide on how to do it. So I think the beauty of this is that it enables that, I would say, interface that before we needed someone to do it for us. And it should help and streamline that. It's not there yet today, but we will, there's a lot of efficiencies to be gained in that process. That doesn't mean that we won't need people, right? I don't think AI is going to replace everyone. I think it just transformed the nature of the work and it enables doing more with the same amount of people and yeah, I think it's a great opportunity for driving operational efficiencies and unlocking new levels of creativity, of human creativity.
Yeah, it is really what I've noticed is the importance of workflow, like in documentation and like logging artifacts and progress, because you make so much, right? Like you just in your own, because you can deploy all these agents to solve all these problems, and you can come at in the period of like 90 minutes, you can come at a very counterintuitive outcome, before going in, right? And like, I mean, I would even insofar as like putting together, strategic, business development, strategic frameworks for companies. And it's like, no, this is massively, deep research, contextualize, and the result doesn't, like I say, it's counterintuitive. And so like what I've realized is like for my, even for myself, because I can be running multiple projects, I think, wow, how all these paradigm shifts, but like I haven't fully embodied the change. And, it's like, I know exactly how to work out. I know exactly what to eat, but I don't do it. And it's like you trick yourself just because you've found the solution, that you've actually implemented the activities that are going to get you the outcome. That's my own personal struggle. And other innovators that I talk to, they've suggested the same thing. And those are people kind of frontier, borderline fringe who aren't necessarily constrained by company AI policies, for example, right? And like here local to the province, I think I was talking to an innovation lead here, and I think it's like between 60 and 70% of the population that's not retired and is working, the professional is employed by the government, that are not allowing the use of AI. And I hope I'm not misquoting, but just pretend that that's even hypothetical, but you see the problem that presents, right? It's like, first of all, just using this technology every day, one of the things that I've had to let go of is that, like, it's not like anything else I've ever learned. It's just when you get your footing, there's the next wave of tools that are like, wow, okay, so I got to be fluid in my usability of it. And, like I liken it to like my grandmother using my desktop computer, and then like a pop-up warning comes, which is basically like a legal agreement contract that I have no time reading. I can't read it. Right. And so I don't, but I tick the box and I go, and grandma's like, what are you doing? Like, we got to read that. It's like, that's going to take us like 3 hours to read, and to understand and to consult with our lawyer. Right. So it's like, do you want to use this thing or don't you? So there's that side of things too, right? Like, there isn't the, kind of, regulatory frameworks in place. And when you're in a space like healthcare, like, I just saw something, this is outside of AI. I just saw a report probably facilitated by AI. It's like 111 compounds have made their way into our food supply that haven't been formally because of some kind of regulatory loophole, right? And how you name things, like grapefruit seed extract is not the same as grapefruit seed, right? It's like when you change the concentrations of things. So the reason that I pull that analogy is because you have these like advances in food technology that is like apparently good, but it's not. And it's like, because these things are causing downstream health effects. It's like, you have these advances in AI that allow you to get to the outcome faster, but like maybe it was never the right outcome. I guess that's kind of the question that I've arrived at, is like, well, what is the right outcome? And I'll say one more thing, because you said something very, me, quite striking, like the difference in Argentina and the US. It's like, well, how we define healthcare and what we value is different, and there's huge cultural influence there. And it's like, these tools are on the frontier. It's like, do they have time to consider cultural context? So I'll pause there, because there's a lot of stuff that you made me think of. So yeah, over to you.
I mean, yeah, at the end of the day, we are wired to what we have learned and throughout our history, right? And the way that we see problems and our thoughts are deeply, let's say, affected to how we were brought up and in what context we were brought up, right? So I think the cultural aspects, inevitably, you're going to have a bias, an unconscious bias, in terms of how you were brought up and what you experienced in your life, and whether you come from a culture that sees things one way or the other. Right? So I don't think it's like a rational, let's say, thinking. You can do the thinking and you can think of the cultural implications. That requires like I would say, a thoughtful effort to do it. But I don't think that on any personal way, you make decisions as you go, and that comes with your internal biases.
Right.
But that's part of the I would say the nature of how we are wired.
So we're running ahead, sprinting ahead with all this new AI technology, and we're making emotional decisions.
Yeah.
Yeah, and then justifying
100%.
them logically. Yeah. Okay.
But the other piece that I think it's important to say is, when you started, you said, well, sometimes you get to a point in which you get something that is counterintuitive and so on. This is why it's also important to have your human critical thinking, right? And thinking through, is what the AI is bringing to me, does it make sense? And go through the chain of logic and see whether it makes sense or not, or where are there things that well, don't add up. And this is where I think our critical thinking is more important than ever, because it's also important when we build AI solutions, for those solutions to be, well, not a black box that we can't especially for healthcare decision making, right? We need to be able to audit and understand what's happening inside, and be able to judge with critical thinking whether it makes sense or not, because we're dealing with people's health. Does that make sense?
It does. And I think it's like a great kind of like bring it home type of question here, which, I think you're in the best position to answer. And that is like, because the entrepreneurs and the technologists and the innovators are going to be doing this are probably going to, they might have medical backgrounds, but probably not. And so what I'm asking is, what advice would you give to entrepreneurs or innovators trying to navigate this digital health landscape now without a traditional medical background? It's because you've been doing it. You have that background. I think there's going to be a wave of people like you.
Yeah.
Yeah.
I mean, I think it's important to partner with the right folks and not assume that you know everything, right? And bring on board people that can add different perspectives. I think it expands the depth in which you can come to solutions, because sometimes you have people who come with a medical background and they're also biased by the way they were trained and how, oh, this is the way you do things. And sometimes for instance, I found myself in discussions with people that said, well, no, if this doesn't have symptoms, well, we can't predict it. And then we go in with AI and we find that there are some markers that were not, let's say, visible or as a symptom, or were not previously associated to that disease state or something like that. And you can find predictors that might not be a symptom, and you can early detect the disease. And this is happening every day. So I think the innovator mindset needs to be there, the open-mindedness or being open-minded, let's put it that way, to considering, exploring other pathways, and being willing to fail as well. Because this is where you need to invest a little, use a little bit of human intuition, and be willing to fail and adjust.
So what kind of person do you think needs to hear this most? Remember, I asked these 3 DNA of things questions. Number 1 is, we talked around a lot of, really interesting things in digital health, digital healthcare. What's our main takeaway that we want to have listeners come away with and feel, empowered by, and what group of people, type of person needs to hear that? That's number 2. And then number 3 is, who would you recommend as my next guest?
So to your first question, I would love this to be a call to action to all innovators and investors, that this is the time to transform healthcare. We have the tools to make the healthcare system much more humane, and that delivers a better experience to patients, that can keep people healthier for longer, increase their health span, and that can, where we can intervene earlier at a much lower societal cost. But it requires bold innovators that are willing to take those calculated risks, and investors who are willing to support this process, that can be highly rewarded for doing so. So I think that would be, I would say, the key takeaway for this. And I would say these 2 stakeholders are the main stakeholders for this message: innovators and investors. And in terms of who to recommend, I have 2 people in mind. One is Sean Cassidy, who is the CEO of Lucem Health. It's a company that helps early detect disease, applying AI algorithms into healthcare systems, EHR data, and helps operationalize those data points into diagnostic pathways or therapy pathways. And the other one is Sam Glassenberg, who is a trailblazer innovator that founded a gaming company that uses gaming technology and thoughts to educate healthcare professionals. He's now leading the gaming department of Relevate Health. And I think those 2 would be great additions to your podcast list.
Amazing. Thank you. Well, I will, through you, I'll reach out to them and certainly extend the invitation. So this is amazing. I learned a lot. This is outside of my, realm, like the private equity side. Certainly, we found common ground in, digital health and just how exciting and overwhelming this AI wave frontier is feeling. But yeah, so thank you very much for being so generous with your time.
No.
I really appreciate you. Thank you.
Thank you for the invitation. It was a pleasure talking to you, Jeremy.
So a big thank you to Mariano. Thank you for bringing such clarity and such boldness to this conversation. He helped us to, reframe at least how I think about digital health innovation, not as a technology problem, but as an operationalization problem, a human problem, a cultural problem. So for listeners, what I'd share as a takeaway here is, if you're building health tech, if you're investing in healthcare, or if you simply care about our ability to keep people healthier for longer, Mariano's insight about the gap between models and outcomes is essential. It's not about smarter AI necessarily, although that will help. It's about architecture, building systems that fit into how doctors and patients actually live. Thank you all so much for joining me for another episode of DNA of Things, and we'll catch you next week.